Our mission statement is Alberta Lamb Producers is a dynamic partner in building a sustainable, thriving industry for sheep producers. Through advocacy, education, training, communication, research, and ongoing community building, ALP proudly supports every producer in our province and has since 1972. We are recording this webinar, and we will make it available on our website next week. You'll be able to watch it again if you want to, or if anyone who wasn't available to attend tonight, they're able to watch a recording of it later. Our first webinar with Dale Engstrom and other great educational videos are also housed permanently on our YouTube channel, which is called Sheep Central Alberta. This webinar is called Thin Ewe Syndrome, Tackling Production Limiting Diseases, and we're lucky to have Dr. Lynn Tate with us today to present on this topic. I'll be turning over the microphone in a few minutes, but first I'd like to give a few housekeeping notes. So when I turn over the microphone to Dr. Tate, she'll also replace me at the top of the screen there. If you're having trouble with the audio, you can call into the toll-free number that we showed on the first slide. And that number and all those details were also included in your registration email. So here's a quick look at our agenda this morning. Following Dr. Tate's presentation, we'll have time for some questions and answers. So if at any time you have any questions, feel free to type in your questions and make sure that they'll get answered. You don't have to wait until the very end of Dr. Tate's presentation. You can type them in at any time. So to ask a question, all you have to do is type it into the little GoToWebinar box that you see on your control panel there. Right above the question box, you can see the handouts, and there are actually 3 handouts there that are notes from Dr. Tate's presentation. So you can download them, print them as you wish. So thank you to Growing Forward 2 for providing funding to help deliver this webinar. Growing Forward 2 is a federal, provincial, and territorial initiative. So I now have the pleasure of introducing Dr. Lynn Tate. Dr. Tate graduated from the University of Saskatchewan in 1990 with both a degree in agriculture and veterinary medicine. She is currently the co-owner of OC Flock Management, which since 1996 has provided small ruminant veterinary consulting services, as well as running CFIA-approved and CETA-certified semen and embryo production facilities. Dr. Tate has worked on international projects in a wide variety of countries and is a contract instructor at the University of Calgary. So without further ado, I will turn things over to Dr. Tate.
What we're going to talk about, the thin ewe syndrome, is exactly what it sounds like. We see animals that have often slow weight loss over time, and there's some underlying production limiting diseases that are typically the cause of this and also relate to the overall welfare of those particular animals and to the flock in general. So what we'll do tonight is quickly discuss the diseases themselves, a bit of an overview for people who maybe aren't as familiar with them, and then talk about some strategies to determine what you have in your flock and then how to go about managing those diseases. Okay, so what is a production limiting disease? In general, these are diseases which affect performance and profitability, but are not necessarily acute illness for the animal. So often these are not the animals that are going to get sick quickly or die or have a fever, those type of things. These are sort of slow underlying problems within a flock. They're not always obvious and chronic in nature. So a lot of these, the animals pick up the diseases, become infected quite early in life, but it can take sometimes many years before they actually show up clinically in the animal. These are diseases which impact the welfare of the individual because they are sort of a slow degenerative type of disease. And most of these diseases in sheep, we do not have vaccines to prevent them, and they are not treatable. So once an animal has the disease, they have the disease forever. Okay, so tonight we're just going to cover what I feel are 4 of the major diseases that we see quite commonly that would fall into this thin ewe syndrome. As you can see in the bottom right-hand corner of the slide, nobody really wants to see a sheep that looks like this in their flock, but this is commonly the presentation that we see for this group of diseases. So Maedi Visna is one of them. Johne's, or it is also called paratuberculosis. Caseous Lymphadenitis, which the industry often calls CL, or it's pseudo-tuberculosis. So lots of terms for confusion. And parasitism. And parasitism is certainly becoming a much more significant issue, especially with the problems we're starting to see with drug resistance. So there's not an easy treatment. So first off with Maedi Visna, this is a disease that slowly destroys the lung tissue. So I've got a little picture there showing what a normal lung in a sheep would look like, and you see this sort of thick collapsed lung without as much air in it in an infected sheep. This is a very slow process over time. These animals are usually infected shortly after birth, if not in utero, and so this progresses through their lifetime, and as they get older and have more and more lung tissue affected, they have more trouble breathing, more trouble getting around, more difficulty getting enough to eat, and so that's where we tend to see them go downhill. So as you can see in this picture, we have a nice healthy looking lung with air in it, and then we have a much meatier lung that almost looks like a liver, and this is what happens as the virus slowly invades and damages the lung and causes scarring over a period of years. What we also see is we will see this virus invades the tissue in the udder, and clinically we will often see this as a syndrome called hardbag. So the hardbag ewe is not necessarily a thin ewe. Often they can be a younger animal, they're in good condition. Where we see the significance to that is that lambs, when they try to nurse off this apparently normal looking full udder, there's no milk production. So lambs, often we see starve outs in more of an extensive based management system. Hopefully the owner in a more intensive management system would catch this and realize that the lambs weren't getting anything to eat. But this is often confused with the mastitis, but it's generally the hardbag doesn't have any heat or infection or pain or anything like that. It just looks like a full udder but has nothing in it. Next slide, please. Okay, so Johne's disease, this is the paratuberculosis. It's caused by mycobacterium, which basically gets into the intestinal tract. It invades the gut wall and causes it to become very thickened. So you can see the picture on the left obviously is a thin animal that is suffering from Johne's. The picture on the right-hand side, the top piece of gut is what a normal piece of intestine would look like if you cut it open. The lower picture is a Johne's affected piece of intestine, and you can see how the wall is very thickened and the ridges are very high. And the reason that these animals lose body condition is because no matter how much food is going through those intestines, because the wall is so scarred, they're not able to absorb the nutrients out of the food appropriately. So you're feeding the sheep is eating, but the sheep's not getting the nutritional value from the food. And unlike cattle, we can see sheep that are quite significantly affected by this bacterial infection, but that they don't have diarrhea. Cattle are quite classical in that between the ages of 2 and 5, if they're affected with Johne's, they'll get the diarrhea and then the wasting syndrome. So they cull themselves out of a group very quickly. But we can certainly see sheep that are 6 to 10 years old that don't have any real clinical signs other than they may be on the thinner side. And if those animals are examined by postmortem and the gut is looked at, they will find that they can be positive for Johne's disease. The little square picture at the bottom, Johne's disease is what we call the tip of the iceberg. The sheep that you actually see in a flock that are clinically thin and show evidence of Johne's disease are a very, very small portion of the number of animals in the flock that are actually infected. And so that little pyramid just shows you how many are clinical, how many are subclinically infected, how many would test positive that aren't really showing any obvious signs, and then how many would test negative but are still actually infected by the bacteria. And this sort of pyramid hiding the majority of the disease is one of the reasons why it's such a difficult disease to manage and very difficult, if not impossible, to eradicate from a particular flock. Next. Okay, so the next of the 4 diseases is CL, or Caseous Lymphadenitis. This, in the scientific world, is called pseudotuberculosis. So, you know, there's a lot of confusion between which diseases are which. What I've shown here are some pictures. Now, Caseous Lymphadenitis occurs in lymph nodes, hence the name, and the pus in the lymph nodes gets very dry and almost like casein, which is the kind of curry stuff that cheese is made from, and so hence the name. The very left picture shows a lymph node with this really dry caseous type abscess in it. The middle picture is a set of lungs, and those circles that you see between the 2 sides of the lungs, those are actually lymph nodes that are in the tissue between the lungs, but that have caseous abscesses formed in them. And then the third picture on the right shows that the caseous bacteria, although it normally lives in lymph nodes, it can get spread through the bloodstream and end up forming liver abscesses and lung abscesses in these animals. So the picture at the bottom, and yes, I'll admit it's a goat, not a sheep, but it's easier to show these sites on a goat because they don't have wool. The little red dots show where the normal external lymph nodes are in a sheep or a goat. So these would be the areas that we would be looking for swellings or abscesses if we're considering that we might be dealing with a Caseous Lymphadenitis infection. The most common one we see would be up on the side of the head just below the ear. And the second most common one I see is that one that sits just on the point of the shoulder. Occasionally we'll see them in the lymph nodes in the hind leg and in the flank area, but not as commonly. What is one of the big issues with this disease is that you will see many areas that get infected with internal abscesses, and you can't see those, not without the animal dying or being euthanized and doing a post-mortem. And so often animals that are actually affected by this disease, it's not obvious to the owner. And they often fall in this thin use abscesses cause has this going on. Side ab is external and is seen, regresses, whether you lance it or whether it regresses on its own. That animal is still infected and will carry that infection for life. There is no cure for the infection. So that presents one of the challenges. Okay, and the final of the 4 main diseases that contribute to this thin U syndrome is parasitism. And the SCOPS program is out of the UK, and it says here what it is. It's an industry-led program. They recognize that anthelmintic resistance is one of the big challenges. Now this is to the future health and profitability of the UK sheep industry because it's a UK-based organization. I think that you could easily replace the world sheep industry into that and would not be incorrect. Canada is still very fortunate in that winter is a good part of a parasite control program, but it's not going to save us forever from having good parasite management and control programs that are not just drug-based. And certainly in clinical practice, I'm starting to see more and more where parasitism and drug-resistant parasites are becoming a more significant issue and contributing to this thin U syndrome. Next, please. Okay, so how do we go about tackling this? This picture here is pretty dramatic, but I've been in flocks where this is exactly what we see. I guess I feel two ways about that. Is one, I would like to see a flock tackle this program long before you ever get a sheep that looks like that, from both an animal welfare and a management practices perspective. That is certainly not the kind of thing one would want to have seen in the flock. But then where we have to tackle this is, unless we can determine the cause, then how are we going to decide how to go about dealing with the problem on a flock basis? The solution for this particular individual animal, in my mind, is not really negotiable. That's an animal that should be euthanized. It's in incredibly poor condition and would be inhumane to keep it alive. But the bigger picture is how many other of those pretty normal-looking sheep are affected by the disease, and how do we manage those particular individuals. Okay, so the first step to all of that, obviously, is to determine some sort of a diagnosis. How do we decide which disease we're dealing with? And sometimes it's more than one. So we'll talk about that, and then we'll talk a little bit about the management aspects, and then prevention and control. Okay, so diagnostic tests. These are sometimes clinical signs. These would be things that you might see that you would consider abnormal for your sheep, whether that's the thin ewe or you see an abscess on the animal. Those are the type of things that we use clinical signs as a diagnostic tool. There are blood tests available. Some are better than others, and we'll talk about those. They can be used to diagnose individuals. They can be used as screening tests to see what disease status would be in a flock. We certainly have fecal tests, in particular for use in diagnosing and managing Johne's disease, because it's a fecal-based organism that causes it, and obviously for parasites and parasite control programs, that fecal tests are quite useful. Production records. I think that production records are underestimated in helping to determine if you have underlying problems in the flock. Often, without really obvious clinical signs of disease, we will still see drops or losses or failure to reach production goals. So if a flock doesn't keep any production records, and they have, say they have underlying Maedi Visna, maybe they're not seeing a lot of clinical hardbag cases, but ewes that are positive for Maedi Visna typically have a lower amount of milk production and lighter weaning weights on their lambs than ewes that don't. So, I always think production records are important because, yes, they're going to help you with good and bad genetics, but I also think that sometimes we can find some clues to health status and some underlying issues in a flock by looking at production records, not necessarily specifically for an individual, but as an overall group. There are flocks. I'll give an example in a goat herd. There are two particular herds. They're dairies. They milk commercially, and the one dairy knows that they have a low level of CAE, which is kind of the goat equivalent to Maedi Visna, in their does. The other herd is clean for it. They've been clean for it since the beginning, and they've worked very hard not to get CAE into their milking does. The somatic cell count in the bulk tank from the herd that has CAE is always significantly higher than the somatic cell count in the bulk tank test from the herd that doesn't. So by looking at those production records and knowing that, that can give us a clue that high somatic cell counts in dairy goats may be an indication of an underlying CAE problem in the herd. So we can use production records for those types of analysis. They don't always give us the whole answer, but they certainly sometimes give us some clues. Also then postmortems. Postmortems are my favorite diagnostic tool, and I think that producers should realize that if you have a thin ewe, that if you haul her to the auction and you sell her for $50 or $60 and you pay for your gas to go to the auction and back home again, I think that for the money you would get for her, you would make a far better investment to have a post-mortem done on that ewe, because then you can see the inside, and you can look for things like internal abscesses. You can do some additional lab tests for things like Johne's, and that will give you a very good indicator of what's going on in your flock. Probably a much better return on your investment than a lot of the blood tests or other, diagnostic lab tests that we have, because the lab tests on the live animals are not always super accurate. So never undervalue a postmortem. I think they're a tool that's maybe not used often enough. And I know that people say, well, it's an old sheep or it's a skinny sheep and it's not worth a lot of money, and then I'm going to spend a few $100s on a postmortem and diagnostic work. But I think you'll get more return on that than just the cash for your thin animal. I guess my other lies in the sort of the responsible producer, humane aspect of it, is I don't firmly believe that you shouldn't just sell your problems to somebody else. So that's my little moral lecture for this webinar. Next, please. Okay, so before we go on to management, in the little handout section that you have on the side of your computer screen, there is a handout there that's called Diagnostics. It's a little PDF. So I'm going to go through sort of some of the diagnostics that are available and sort of their pluses and minuses for the 4 diseases. So I've given you this chart as a hand. Necessarily have to be scribbling like crazy to make notes, even if you can't necessarily have it right in front of you at the moment. But there's a lot of discussion about different sorts of tests, and I get calls from veterinarians all the time saying, is this really a valuable thing for my clients, or are the answers not really going to give us enough answer to justify the cost? So if we look at Maedi Visna, in the live animal, we have some clinical signs. We get the ewes with hard bag. A ewe that has an apparently normal-looking udder at lambing time, and you cannot milk anything out of that, hard bag and Maedi Visna should be the first thing that comes to your mind, not mastitis. Often with mastitis, you can milk them, but it's hot and it's painful, and the milk is abnormal. The other thing is that the lambs can pick up the infection from nursing. So one of the things, if you don't see hard bag but you get a positive ewe, is you need to consider that their offspring, even without necessarily testing them, are probably infected from samples. So test is fairly accurate. False positives would be rare. So a positive is a positive, and you should consider that a real test. It takes time to build up the antibodies in the blood system, and so young animals won't test positive, so we don't waste our money testing them. And we also don't test generally 45 days before or 45 days after lambing, because they dump a lot of into the colostrum. Postmortem, you can do tissue samples of the lungs, can be looked. Okay, so yeah, so if I was a little chopped up on the Maedi Visna, basically what I covered was covered on the little handout chart. So you can certainly take a look at that, but my recommendation with Maedi Visna is hard bag ewes. You need to be very suspicious that that's what they are. They can then be, you can use the blood test to confirm that. The blood test can be used for flock screening to identify infected individuals or determine if the infection's in the flock, but not generally in animals under a year of age or in animals close to lambing, either before or after. And on postmortem, if a postmortem was being done for other reasons and you were suspicious of Maedi Visna, you definitely, the samples of lung tissue can be sent to the lab to be examined microscopically. For Johne's disease, on the live animal side, we can do fecal tests. The two main ones on fecal samples are what they call a PCR, And what this does is this test actually looks for the DNA of the bacteria in the fecal sample. It's a very quick test to do, but the drawback is that if the animal's not shedding the bacteria at the time when you take that sample, the DNA of the bacteria may or may not be present. So definitely we see false negatives. The other one is fecal culture. Fecal culture is the same in that the bacteria has to be there in order for the lab to grow it. And they will often grow these cultures for up to 12 weeks before they will say that it's negative. That they've given it 12 weeks to grow and no bacteria has grown. So it takes a long time. Neither one of these tests are inexpensive. So they can be used sometimes to identify individuals that are clinical cases that you may want to determine, and sometimes they're used on pooled samples as a flock screening. So they would pool 5 to 10 fecal samples from 5 to 10 animals together, and then if they get a positive in that, then they would just go back and individually test the positive animals, or the animals in the positive group. There's a blood test for Johne's disease. It was developed predominantly for cattle. It's not a great test in cattle, and it's an extremely poor test in sheep and goats. So although it exists and it's sometimes used for flock screening, I personally would have a very hard time convincing a client to use it, because I just don't think the return on your investment for the time and the cost of the blood test is actually worth the money that is spent. Ideally for Johne's, probably the best diagnostic samples are from postmortems. They can take sections of the intestine, they stain them with a special stain that sticks to the bacteria, and then they also have the microscopic changes to the gut wall that are consistent with the infection. So, the postmortem as a valuable diagnostic tool, certainly in the case of Johne's, is a very good tool and probably the best diagnostic tool. Caseous lymphadenitis. Obviously, in the live animals, swellings or abscess formations at the site of external lymph nodes is a pretty obvious one. The important thing is to differentiate whether it's caseous lymphadenitis in a lymph node or whether it's just your run-of-the-mill abscess that occurs from a sliver or a puncture wound. Those typically occur in sites that are not associated with lymph nodes. So the suspicion flag goes up when you see a clinical swelling, but if you want to be certain that it's caseous lymphadenitis or not, a small amount of the pus can be sent to the lab and they can culture it. So that would be a definitive diagnosis. If sometimes a veterinarian, certainly with experience, can look at the location of the abscess and go, no, that's not caseous, it's not in the right place, there's no lymph nodes there. But a culture is definitely a definitive answer of yes or no. For internal abscesses that you maybe haven't seen any evidence of caseous, again, the post-mortem exam will reveal those internal abscesses. So that tells you whether or not you've got some caseous in your flock, and certainly whether or not it's in that specific animal. Parasitism. So there's a large number of different types of parasites that affect sheep and goats, but the vast majority of them do live in the gut. The one exception would be lungworm. But either the eggs or the larvae from most of the parasites we see can be detected on fecal examinations. So this would be taking fecal samples, and there's 2 or 3 different techniques to examining the feces, how it's the solution it's diluted with, and the method that's used for concentrating it to look under the slide. This will vary depending on what type of parasite that we're looking for. And timing is important too. A large portion of parasites in sheep and goats, they hibernate in the wintertime. So what they do is they kind of burrow into the wall of the rumen and just hang out. And so if you do fecal exams this time of year, you can get very low egg counts, and that doesn't necessarily mean that there aren't a lot of parasites in those animals. It just means that the adult parasites aren't active at that point and they're not laying eggs. And so what we get is as they come into springtime, we talk about the periparturient, or just around the lambing time, we get that rise in egg counts when we do fecal exams. And that's because that's typically in the spring for most people for lambing. And the parasites come out of hibernation in the rumen wall and start producing eggs in the gut, that then they're shedding eggs out into the environment. So timing is important. As far as the highest level of parasite infection or infestation that we would see, doing fecal counts in mid to late July in this climate is usually your peak levels on pasture. So if we're looking at doing fecal exams to try and determine whether or not to actually use chemical dewormers, we would like to do them mid to late July. Because at that point, if the egg counts are still very, very low, then those animals will get through the rest of the grazing season and into the fall without probably experiencing any real issues. If those fecal counts are high at that point, then we need to look at reducing the level of parasites in those animals. Otherwise, by the time they get through the grazing season, it could be a very significant problem, both for the individuals and for the flock. So one of the things we use for doing that as part of the fecal exam is something called a fecal egg count. And it's a precise, where we measure an actual weight of feces, and then we put it through a process where we break it down and put it in a solution, and then we use a special slide that has a grid system on it, and you count the number of eggs, and then you get an eggs per gram. That's your fecal egg count. And there is data out there on that that tells you how many eggs per gram are acceptable before you need to actually deworm. And so part of the whole management strategy at this point is using this information to design a more specific deworming or parasite management program, rather than just they should get ivermectin before lambing time, or they should get treated with valbazine in the fall. The third thing that's used as a diagnostic in live animals for parasitism is the FAMACHA system. This is a system that was developed in the southern United States, and basically what it does is it uses the conjunctiva, that tissue surrounding the eye of sheep and goats, and it determines how white or pale that is as an indicator of the level of parasitism in that individual animal, and they do chemical deworming based on a grid system that was developed that goes with that. And it's a good system, and it's a good on-farm system. The thing we need to keep in mind is that it only assesses the effects of the Haemonchus worm that affects sheep and goats, and that's sometimes referred to as the blood-sucking worm or the barber pole worm, because a lot of the intestinal parasites that we deal with don't actually consume the blood of the animal. So they're not going to make the animal pale. If you have normal strongyles in the gut of a sheep, to the point at which that sheep is becoming pale due to lack of blood, that animal has an infestation that is almost beyond recovery at that point. So the FAMACHA system works for Haemonchus, but it's not very accurate for other parasites. By the time it becomes significantly different with those other parasites, you have a massive problem on your hands. Blood tests for parasites. The only blood tests that exist for parasites are for parasites that live in the blood. And typically in Canada we don't have those. We don't live in a tropical climate, so there isn't really any blood tests that we use to check for parasites. And then obviously on postmortem, if a postmortem is being done for any other reason, then open up the intestines, open up the rumen, check the liver for flukes, and sometimes then we're looking for the adult parasites in that animal. It's just part of the diagnostic process of doing a postmortem. So that material, again, it's all kind of outlined and covered on your little chart, and I think it's important to be aware of, because there are different tests available for different things, and where and how they're used really is sort of it's an individual thing. It can be unique to a flock depending on what their known or unknown disease status is. But I think you need to be aware that there are different options out there. And again, that whole postmortem column, don't underestimate the value of what one, dead or dying or should be euthanized animal can tell you that you can use to help the overall betterment and the overall health and welfare of the rest of your flock. Okay, so then we move into the management section. Now this is very individual to each flock, so I'm just going to give you some things to think about because I can't sit here on my end of the computer and design a management program for a flock I've never seen. So some of the things to consider are the level of disease. So some of your management may be just determining that, or maybe you have a problem with Caseous, but you're fairly certain that you don't have much of a problem with Maedi Visna. So how it's approached is how significant is the disease to that flock, because sheep live outside, and it's very seldom you're going to see a flock that's completely free of everything. It can be done, but it's a big investment, and it's not necessarily for everybody. Economic considerations. Testing costs money, but I think that money spent to sort of determine where you're at with diseases in your flock is only good money spent if you plan to do something with the information. I've told many a client, if you are not going to cull your positive sheep for Maedi Visna, then don't waste your money testing them, because it makes no sense to spend all that money if you're not going to do anything with the information. And then there are the animal welfare considerations. I have put in your handouts there the pages from Chapter 4 of the Sheep Code of Practice. The code is excellent. There's a lot of good information in there, but it is 106 pages long. And so I just took Chapter 4 because it talks about animal health and animal welfare and how the two things go together. And I showed you some of those pictures of those skinny sheep. I don't think that we should have sheep that look like that in a flock. I think those situations need to be dealt with far before the animal gets to that point. And it concerns me deeply when I see sheep that look like that at an auction mart. Because from a welfare standpoint, they shouldn't be there. They shouldn't have probably been transported. So there's also a couple of other pages from the code that have little flow charts on determining when an animal should be euthanized, and you can use those for your reference. Like I say, the entire code is excellent, but it's a long read, so these are more focused to what we're dealing with. I truly believe that from a management standpoint, it's no longer acceptable to just ignore the problem, to just have an animal out there like that and say, well, you know what, she'll die eventually, or to ship her off to the auction mart to basically just move your problem on to another farm. I don't feel that that's fair or humane to the animals, and it's certainly not very ethical as far as being a producer. To go directly to slaughter, if they have enough body condition, I think that is quite acceptable. And I think the other thing from a management standpoint is be proactive. Pay attention to your flock. Maybe do a little bit of diagnostic work, a little bit of, even your own sort of investigative work, really looking at your animals and really being honest about what your issues may or may not be or what you're seeing, and be proactive about it, because I think that's far better than when you get behind the 8 ball, then trying to get out of a bad situation is always more costly and often not anywhere near as rewarding. And for producers who have reached a point where they really don't deal with these diseases in their flocks anymore, it's a nice place to be. You don't realize how much of a loss and a headache these diseases are until you don't have them. Okay, next. Okay, so prevention and comes with management. I will go to my grave believing this statement. I put it in red and yellow so nobody misses it. In sheep and goats, if you have these diseases, you paid for them. And if they matter to you and you want to work towards minimizing or eradicating them for your flock, don't go out and buy them again. I see this over and over again, and I've dealt with flocks that were built on, they bought sheep from everywhere or culls from the auction because they were cheap, and in the long run they're not cheap because they're going to cost you. But I've also worked with flocks that have worked very hard to eradicate Maedi Visna and then gone and bought animals with no thought process as to the fact that they may be at risk, and they basically have bought themselves the disease right back again after spending a lot of time and money to get rid of it. So consider the closed flock concept. Now I realize a completely closed flock for many producers is not the most viable option, but there are certainly more and more producers that are looking at not buying females. They say, you know, we will raise replacements from within, we will deal with the issues we have, we will work on that, we will basically close that aspect of it, we will just buy in rams. You know, and partly the safety factor is you're buying a lot less of them. You're probably buying them less often, and you can be very choosy about what you're buying. If you're buying 2 rams versus 100 ewes, you know, you can really afford to shop around and be choosier about health status, not just genetics, and be willing to pay a bit more for that health status because you're buying in small numbers. Building from within, yes, you may have your own problems from within, but if you determine what those are and work with that, that's still better than the unknown of what you're buying from anywhere else. So that falls into my second point about the sourcing new stock wisely. Be careful where you're buying and ask questions. Go to the farm. Look at the animals. I mean, we've talked about these diseases and things to look for. I go to lots of places, and I can tell you that the first 10 or 15 minutes as I walk through somebody's flock, I have a pretty good idea whether or not they have Caseous Lymphadenitis in their flock. They may not have big abscesses, but I'll see animals with scars or little bald spots where no wool or hair grows on the side of their face. It's a clue. So you need to have your eyes open, and you need to ask the questions. You know, if you say to somebody, well, do you have yonis? They could very honestly say, well, no, because they don't know. So, you know, you sort of need to look more like body conditioner. You know, oh, do you have trouble keeping weight on, you know, your older ewes? You think about how you're asking the questions, and that will help. And then last, I guess, in this section is work with a flock veterinarian. It is a little bit of money to spend, but in the long run, I think a lot less money than the losses add up to. And I'm finding there are more and more people, especially new graduates, that are quite interested in small ruminants. They have taken some time to learn about them, especially at the University of Calgary, because they get me lecturing at them, so that they're more comfortable working with them. So I think it's getting easier to deal with a local practice and find somebody who actually wants to understand and cares about the sheep and is willing to work with them. And I get a lot of questions from new grads that they send me by email, so I know that means they're working with their local flocks. And they're trying to do a good job. And in the long run, I think you're further ahead for having that relationship versus just kind of flying out in the wilderness by yourself. And so when I first graduated, most self-respecting veterinarians who did cattle practice were not really polite about sheep. But I think that's changing. They're starting to see the sheep as quite a serious industry, and as more of their cattle clients are also getting into sheep, they're increasing the respect level. So I think that that's one thing that people maybe miss, that I think there's value to that. Don't think about the veterinarian just as some sort of a big cost, because a little bit of money and time spent working with your veterinarian on a flock health program may save you emergency calls in the future, which are probably going to be more expensive with a poorer outcome. Okay, so, that's not too bad. So then we have time for some questions if people have any questions. It's been a fairly brief overview. We could probably spend an hour on each one of these diseases, but the hope was to kind of introduce you to some concepts and maybe get you thinking about them within your own flock. And to me, this picture at the end, this is everybody's goal. And healthy, happy sheep get there easier.
So just a reminder to everyone, please feel free to type in your questions. These are going to be anonymous, so we're not going to share your name or with the question. We have had a few questions come in, Lynn, already, which is great. First question I have here. Is this the most common cause of hardbag? And I believe that's when we were talking about Maedi Visna.
Maedi Visna, true hardbag, Maedi Visna is the only cause. The differential diagnosis from my perspective to the Maedi Visna hardbag would be some sort of a mastitis. But as far as I know, that true, clean, non-infected hardbag that we see, Maedi Visna is the only thing that causes that.
Great. I have another question here. Can lambs have Johne's disease?
They can certainly get infected very early in life. The infection goes from feces that are consumed. So when you think about where little lambs put their heads, if you have a ewe that has Johne's, especially if she's got loose manure for whatever reason, even if she's just on a higher grain ration, those lambs certainly could get infected. To actually be clinical with the diarrhea as a lamb, I would not say that would be Johne's causing that. There would be other more common causes of lamb scours that would be more on my target list. It takes time for the Johne's bacteria to actually damage the gut. It's not quick like coccidia or something like that.
Okay, great. Another question. What would be the incidence of these diseases in Western Canadian flocks?
Wow, that could vary quite a bit. I don't know if anybody's ever done any real survey. I would go out on a limb and say, based on my experience, a large portion of flocks will have some sheep in them that have Johne's. Whether they look clinical or not, what percentage that would be, I don't know. I've never done a survey. It's not like with cattle where they can say that a third of all the herds have at least one positive Johne's cow in them. But that would be the one where I would think would be very common. Caseous Lymphadenitis, as a veterinarian, my philosophy is it's in the flock until proven otherwise. And I mean, there are flocks that are free of it, but it's very common. Maedi Visna, probably less common in Western Canada than in Eastern Canada. And that's because we allow our sheep to be outdoors in bigger areas. And so in Eastern Canada, where they house them in barns all winter, the transmission between adult sheep is much higher. So I would say, still, a number of flocks probably have a low incidence of it, and it's out there, but not nearly as prevalent as in the East. Parasitism, parasites are everywhere. How many flocks have significant problems? I think that's still probably fairly low because of extensive management and winter. But I think unless we really rethink how we manage our parasites and how we very specifically use our chemical dewormers, it's going to become probably one of the biggest problems we see in the near future.
Okay, great. Question here about deworming. It says, we worm our ewes at shearing in July. We start lambing in January. Should we be worming again before lambing in approximately December, is the question.
I would say that would depend on fecal exams. I really truly believe that there's not just a solid when you should deworm answer. I think that probably doing fecal exams in July to see whether or not they really need to deworm in July, and then maybe again in October, and base it on whether or not you need to deworm as opposed to just a timing. And the fecal exams, fecal egg counts is the only thing that's going to tell you that for sure. I have flocks doing fecal exams that haven't done a full flock deworm in 5 years.
Okay, great.
The cost of fecal exams is pretty low when you start saving on a lot of dewormer.
So next question, and we've got lots coming in, so this is great. Can Johne's disease be transmitted from cattle to sheep?
Yes. So if you're going to graze, ideally, if you're going to graze in rotation, the sheep should graze ahead of the cows, because at least then the cow manure from the previous year has had a chance to overwinter and break down. That doesn't necessarily kill the bacteria, but cows have big wet poop, and sheep have little tiny pellets, so the odds of a sheep ingesting the bacteria from cow manure is much higher, but it can live in the environment. So ideally, co-grazing is not the way to go, but the transmission definitely can occur.
Okay, are there methods to test for CL if there's no abscess or infected lymph nodes, and how effective are these methods?
There is a blood test for CL, and it is an acceptable test as long as you know absolutely for sure that your sheep have never been vaccinated for it, because it just detects antibodies, and so if the sheep have been vaccinated, then they'll test positive. They don't have the disease, but they have antibodies because they've been vaccinated. So whether or not that test is any good depends on the herd history. As far as I know, other than clinical abscesses, that's the only test.
Okay, does hard bag go back to normal after lambing, or does it stay swollen?
Hard bag is that ewes done for life. She's a cull. She'll never milk after that, because the udder tissue is damaged and it doesn't actually produce milk.
Okay. If one is going to start a herd, will it be wise to purchase, so two options, one, ewes then breed them, or option two, pregnant ewes, or a range of sheep pregnant or not? So looking for your advice, taking it from a disease perspective on starting.
From strictly a disease perspective, ewe lambs that aren't bred or have never lambed are probably your safest. You shouldn't have any abortion diseases, which is outside the scope of this webinar, but it's an important one if you're starting. You shouldn't have any abortion diseases in virgin ewe lambs. So that's a big hurdle there. I guess their youth alone, makes them, I guess, lower on the scale of risk for diseases, but I would still be looking hard at what the adults in the source flock look like. Because if you see a lot of caseous in the adults, then those ewe lambs may look okay at the moment, but maybe they've already picked it up. If a person were wanting to buy bred ewes, and there's certainly economic reasons for that, again, very careful questioning of the source flock, and probably like younger bred ewes, like maybe bred ewe lambs, as opposed to buying 5 or 6-year-old ewes with unknown history.
Okay, and following up on that, when purchasing ewes for breeding, what are the questions you should ask the seller?
I think one of the very important ones is if they have had abortions in their flock, because contagious abortion diseases like chlamydia are relatively common, and you don't need to start out with that problem. Again, some of the questions asking things like, which seem sort of innocuous, but how old are your ewes generally when you cull them? If a flock's quite honest and said, well, we cull based on production, not necessarily age, but we have ewes in this flock that are 7 or 8 years old, that might tell you something versus somebody that is culling. They don't have any ewes in their flock that are older than 4 or 5. There are management reasons for that, but lots of times that sort of leads to the fact there may be some underlying issues. And then I think the big thing is just be very observant. Sometimes, what you see may tell you more than what the breeder tells you. And I guess see how honest they are. I mean, if they're very honest, very open, and don't have a problem with you seeing everything, and seem like they're answering a lot of your questions very openly, I'd be more comfortable than if it seems like things are a little guarded. Because often producers know more than they let on about their flock.
Okay, great. I've got 2 more questions here, so I'm going to give everyone kind of a last call from the audience, everyone listening in. Last chance to send in your questions. We're going to tackle these 2 ones that I've got docked, and then move on. So someone here is looking for general advice on how to tackle diseases and worms in organic sheep production.
From the disease standpoint, I think diagnostics and eradication. Most of these diseases don't really have a treatment. So if you're organic and you don't want to, and you're regulated on what you can use as far as drugs and stuff that way, then I think working towards eradication of the diseases and having a clean, closed flock is ideal. Parasite-wise, again, those are programs that sort of have to be tailored to every flock, but things like pasture rotations, management of lambs not necessarily, depending on when you lamb, not necessarily going to grass with the ewes, but being weaned and staying in dry lot. You can do a lot of things to control parasite load without necessarily using chemicals. But it is something that you have to work with somebody to fine-tune to your specific situation.
Okay, great. Question here about CL. Is the abscess attached to the animal, or can it feel like it's in the loose skin? And how long can the infected sheep live with it?
The abscess, I guess it's attached in the fact that it's in the lymph node, but the lymph nodes sit under the skin in the subcutaneous tissue, so that's why they often feel loose. I guess technically you could surgically remove the whole abscess, lymph node and all. It wouldn't be a small surgery, but it would be doable. So, but the fact that it feels like you can grab it and move it around, that would be pretty typical. What will happen typically is these abscesses will get bigger, and often then they'll find they want to open and empty somehow, and so they find their way out, which is usually through the skin. The bad part to letting them just do that is you would contaminate the environment, and that bacteria is tough and it lives on fence rails and things like that forever. So the least amount of environmental contamination, the better, as far as risk to other animals. As far as how long the animal can live with it, I mean, I've seen animals get abscesses that have ruptured and drained, and those animals, could live for years. But I think, generally speaking, they don't do as well as animals that don't have caseous. They're gonna start to get thin and have other issues and abscesses maybe internally. Maybe when they're 2 or 3 years old, they're not going to be around when they're 7 or 8.
Okay, great. And the last question I have here is, how effective is the CL vaccine?
Well, if we could get it, it might be effective. Right now, it's not available at all. The Colorado serum vaccine, it's not. We had Glanvac years ago, which was a nicer vaccine. I think it did as good or better job protecting the sheep, but it wasn't as nasty for the sheep. The Colorado serum, they had a lot of quality control issues with the vaccine, which is why Canada's not allowing it to be imported right now. So it's part of a bigger picture. Just vaccinating will not solve the problem. Sheep that already have caseous will still have caseous, whether you vaccinate them or not. But as part of an eradication program where you vaccinate the young stock to help prevent them from getting infected, while in the process of culling out the older animals that are positive for caseous, it can be used as part of that, and over a couple of years you can eradicate caseous completely from the flock. But right now, unfortunately, we don't have any caseous vaccine available to us. But
Okay.
Vaccinating and not culling won't solve the whole problem.
Great, Lynn. Looks like that's all the questions we have. So if anyone has any other questions and you want to send them over after, you can always send them to me at info@ablam.ca, and I can put you in touch with Lynn. Other than that, looks like, Lynn, you're off the hook.
Okay, well, that'd be fine. Yes, if people have other questions or whatever, my email through OCFLAC's website too. Email is usually the best way to get a hold of me.
Okay, fantastic. Well, thank you so much, Lynn, for sharing your knowledge. We really appreciate you joining us on a Monday evening.
Oh, no problem.
You. And just very briefly before we say goodnight for the evening, when you close down this webinar, you are going to get a pop-up survey. We really want to continue doing more webinars, so we would really like your feedback on what webinars you want us to present and what time of day works best for you, among other things. So look forward to joining us for some more webinars this year. We have lots of resources on our website, which is www.ablam.ca. We've got fact sheets, management modules, past newsletters. We've got lots and lots of resources there that you're welcome to check out. I mentioned our YouTube channel earlier. That's the link for it there. So you can just go to YouTube, just Google YouTube and put in Sheep Central Alberta. That's where we post all of our webinars. So after this session, we will be posting this webinar to our YouTube channel, and there's lots of other great resources there, great educational videos that you can watch. And there is a great upcoming event that might be of interest to you on March 22nd. At Olds College from 10 a.m. to 12 p.m. There's a sheep handling demonstration and body condition scoring workshop with Kurt Pate and Lorna Gibson. And this is actually presented by Alberta Farm Animal Care. It costs $25 and is a great opportunity to do some learning and networking. So you can go to the AFAC website, which is just afac.ab.ca. We'll also have a link up on our website to that to get yourself registered. So other than that, if anyone has any further questions, feel free to send us an email. That's info@ablam.ca, and we'll connect you with Lynn. And we really appreciate any feedback you have on the webinar as well. Thank you so much, everyone, for bearing with us through some of the technology difficulties we had today. It's a bit of a learning curve here with this webinar technology, so we appreciate all of you hanging around. And once again, thanks so much for attending, and have a great night, everyone.